Bismillahir Rahmanir Rahim. Innal hamdulillah wassalatu wassalamu ala rasulillah. Allahumma salli wa sallim wa barik ala sayyidina Maulana Muhammad wa ala alihi wa sahbihi wa barik wa salli wa sallim alayh. We begin today's webinar with the blessed name of Allah subhanahu wa ta'ala, and by sending salutations on his beloved prophet, the final prophet Hazrat Muhammad sallallahu alayhi wa sallam. Jazakallah khair to all the listeners to join in today for BIMA's British Islamic Medical Association's Mental Health and Hajj webinar. We will, inshallah, shortly be joined by our panelists. So, my name is Arshad Latif. I'm a GP based in Nottingham. I'm British Islamic Medical Association's health promotion lead, and we are presenting this first of a kind webinar to the public today. So inshallah ta'ala, we'll start off with our presentation. So a bit about our association. So British Islamic Medical Association was founded in 2013. It is volunteer-led and delivered. It's present in all regions across the United Kingdom. And we believe in strong Islamic values, and we have got strong community links. We're basically a network of healthcare professionals, and alhamdulillah, to date, we got over 1,300 members. And they're not just doctors or medical students. We've got pharmacists, we've got dentists, optometrists, nurses, paramedics, mashallah, a range of healthcare professionals. Our mission is to inspire our members to unite in the service of our patients and profession. And this webinar is to serve that purpose. Of the many aims of our organization, one of the most important one is to promote the better understanding and appreciation of principles and values of Islam amongst all healthcare professionals, and also to promote and protect the health of patients and public by adhering to the fundamentals of Islamic ethics and good medical practice. And hence, we are delivering this webinar today. For more information about our association, you can go to www.britishima.org. For those of you who are new to using GoToWebinar software, just to let you know, if you were to ask any questions, you can type in a question. So if you look on your screen, you can raise the question with a specific panelist, or you can raise a general question with the organizer. So feel free to fire away, inshallah ta'ala. We will be taking questions throughout the session, but we will have a dedicated session of Q&A at the very end of the webinar. So as I mentioned, one of the aims of British Islamic Medical Association is to protect and promote the health of patients and public by adhering to the fundamentals of Islamic ethics and good medical practice. This particular webinar aims to raise awareness of Hajj-related medical conditions, especially mental health issues in Muslim community. BIMA has signed up to the Public Health England's Mental Health Concordant for mental health, and this particular event is part of our work to address this in collaboration with our partner. As most of you might be aware of the sad incident that happened in June 2018, there were 2 suicides in the Sacred Mosque in Masjid al-Haram in Makkah. They were both men, and they had previous mental health problems, and they had traveled to Makkah to perform the Umrah. Now we do know, and there are various studies who confirm this as well, that Hajj and pilgrimage usually has a positive impact on the mental health. But these 2 cases remind us that this cannot be assumed for every person. In 2017, 2.3 million people from across the world went for Hajj, and about 25,000 of them were from United Kingdom. With increases in the quotas for the pilgrim, and also with the summer holidays coming right at the time of Hajj, we expect it to increase about 20% every year, and probably likely to see more elderly and young people going with their families. So hence, we've designed this webinar today, inshallah, to cover the various aspects, health-related aspects that are encountered by the Hujjaj, by the pilgrims. So inshallah, to begin with, we'll start with our first speaker, Dr. Mohammad Jiva. Dr. Jiva is a GP, and he's also the CEO of the British Hajj Delegation. And Assalamu alaikum, Dr. Jiva, how are you today?
Wa alaikum salam wa rahmatullahi wa barakatuh. I'm very well.
Right. Dr. Jiva, you can share your screen whenever you're ready, inshallah, and the floor is open to you now. So I'll let you start with your presentation.
Jazakallah. To those that are listening, I am still at my surgery, so if you do hear any knocking doors in the background, it's probably the staff who don't realize I'm on the phone. So I do apologize. What I'll do is go through a presentation that we tend to give at mosques across the country related to the British Hajj Delegation, of which I'm the Senior Medical Officer, and aspects of how to maintain good physical health. We do tend to refer to mental health, but after me, there is a speaker who's going to speak purely on mental health. So I'll ensure that I don't do a lot of mental health coverage to ensure that there's no duplication. So moving on in terms of the slides.
Dr. Jiva, if you don't mind, just clicking on the share screen button, because we can't see your screen at the moment.
Presentation.
Yes, please, share presentation.
Is it there?
Yeah, that's perfect. Thank you.
Right, okay. So we'll start from the first page. As mentioned, I'm a GP up in Manchester. I've been a GP for the past 20 years. I'm also the Chief Exec for the Rochelle and Bury Local Medical Committee, as well as the Chairman of the local GP Federation. Now, I've been part of the British Hajj Delegation for over a decade, and previously we were part of the Labour government delegation that went out with the Foreign Office officials to provide clinics in Makkah and Mina. And with austerity cuts and changing government, when everything finished, the British Hajj Delegation about 5 years ago became a charity. So we're still led by Lord Adam Patel of Blackburn, and there's myself and Dr. Mohideen who lead the medical side, and we are now a charity. In terms of the medical team itself, all the doctors are volunteer doctors. Each year we go out and provide clinics in Makkah and Mina. The doctors pay for their own accommodation, their own travel, their own sustenance, their own visas, their own draft. And the donations we get from the community are used mainly or predominantly where we need to hire rooms in Makkah to provide clinics. This is usually when we can't find the mezzanine floor in a hotel or a secure area, and we have to take specific rooms to actually run a clinic itself. Even the drugs that we take out are donated by pharmacists in this country, and so all the consultations we perform are free to the Hujjaj, and the medication we provide is also free. The idea of the presentations that we do is to prepare people before they go out for Hajj, but also to make sure that when they are out in the kingdom, they are well prepared for any unforeseen eventualities. Starting at the beginning, in terms of preparation, for those that have got long-term conditions, they'll be on regular medication. Now, when you get your prescription, you'll usually get the right-hand side of your prescription, which looks similar to what's on the screen now. This is a test patient, so that don't worry, there's no confidentiality issue here. And what we tend to advise is drugs that we get in this country, most of them are available in the kingdom, but may not necessarily be under the same brand name, but you'll find them under the same generic name. So what we tend to advise is get a copy of the right-hand side of your prescription, or next time you get your repeat prescription, tear this bit off, take a photograph of it on your mobile phone and put the hard copy in your suitcase. So when you go out, should you need additional medication, for example, if you've lost your medication, you can take this to the chemist and they'll be able to read the generic name and provide you either the same or something very similar. Now, be aware that the drugs that most people may get in this country for free, if they're entitled to free prescriptions, or even if they pay a prescription charge, the cost of the drug may be multiple times the cost of a prescription. In Saudi Arabia, you will be paying for all your drugs if you get them from a pharmacy. Now, as an example, a few years ago when we had a patient with shingles and we had no acyclovir, it was roughly about £50 to get one prescription of acyclovir. So the first key message is make sure you've got more than sufficient medication when you're going out for your pilgrimage, more than you need for the duration that you're going to be there. Make sure it's at least a week to 2 weeks more in case you lose some tablets or they get damaged. In terms of vaccinations, ACWY is mandatory. You have to have one every 3 years, although recently the Saudi authorities have recognized the newer version of ACWY, which has 5-year coverage. Make sure you have it at least 6 weeks before you go out to travel, and also consider the optional vaccines like tetanus. For those who are in the at-risk group, over 65-year-olds and those who have got long-term conditions, although it's not applicable now because flu vaccines are not available and they'll become available somewhere around September, October, usually if they're available, we tend to advise pilgrims to get the flu vaccine as well. Now, that's not to say that you will get protection against flu, because what we've got to remember is that the people from around the world who come for pilgrimage may be carrying different viruses to the virus that's being protected against our flu vaccines. So there's still always a risk, but especially if you've got a long-term condition, it's worth having that additional protection. In terms of going out on the day, make sure you leave early on the day of departure. Make sure, as I say, you've got at least a couple of days worth of medication in your hand luggage. If you put everything in the suitcase and the suitcases are tied up, you get to Jeddah or you get to Medina, the suitcases haven't come through yet, you may find that you'll struggle to get access to your medication. So keep at least 2 to 3 days worth of medication in your hand luggage. Remember, if you've got any needles for diabetes or you've got any other medication like codeine or opioids are illegal in Saudi Arabia unless prescribed by the hospital. So if you're going to take medication, which we think is the norm in this country, just clarify whether you need a letter from your GP to show that the medication is on a medical prescription and not for personal recreational use. One other thing on the day, I know there's a tradition to kind of pack your bags as much as you can when you're going out, more so when you're coming back. But if you want to minimize the amount of stress at the airport, stick to your luggage allowance so that you're not having to open your bags and start rearranging things into various suitcases. When you get to Saudi Arabia, be prepared for long waits. Waits could last for hours, could take up to 12 to 24 hours. So be tolerant. It's not just yourself. Everybody else is going through the same. As our host has said, there's up to 3 million people going through these airports in a period of a couple of weeks. So the Saudi authorities do the best they can to get people through. And now that the system has changed and a lot of it's gone to an electronic system, people do get through the airports a lot quicker, but be tolerant. To make sure you take your medication on time. Don't allow the time delays to allow you to forget when to take your medication. You want to minimize any exacerbation. And remember to eat small meals and drink regularly. Try and avoid large meals. You don't want to be rushing to the toilet all the time, but then you don't want to feel stodged all the time. And very important, make sure you stay with the group. Because as soon as one of you go missing, unfortunately, the tour operator with the rest of his group can't move on, which may have an impact on how long it takes you through check-in and may have an impact on how quickly you can board a plane. So stay with the group, and if you do need to go anywhere, make sure your tour operator knows where you are and when you come back. In terms of identity bracelets, these are the kind of bracelets that Hujjaj have been distributed with in the past, which identify which camp you're in and which groups you've been allocated to. We've suggested in the past that if you have a long-term condition, like you can see in the bottom picture, write it down, because God forbid, but if you ended up collapsing or there was a problem, at least we could have a look, or the Saudi authorities can have a look at your bracelet and see that you have a condition like diabetes, so they can do a blood check first rather than go looking for a reason why you've collapsed. You can also add on any allergies you may have, and if you've got space, write on any regular medication. But do be aware that you're going to be sweating a lot in this weather, so use a permanent marker rather than something that can wear off. When you get to Makkah, there's a temptation to get into haram, do your tawaf, do your sa'i, and then we'll relax. But your body's already gone through a significant impact by the traveling that you've done. So go to the hotel, relax, have something to eat. If you need to have a sleep, have a sleep. Ask your tour operator what's the best time to go and perform your tawaf. There may not be a quiet time because of the number of people, but clearly common sense says that don't try and do a tawaf in the midday sun if you're out in the open, because in this kind of current weather, you're going to get lethargic, dehydrated, and probably end up collapsing after the journey you've just taken. Don't rush into everything. Be aware of the crowd, because there's a high risk that you can sustain injury. And a mental health tip, don't try and take excessive money with you because you think it's safer on you, because I've had doctors in my team who have had their pockets cut while they're doing tawaf. They come back and realize that their purse has gone and all the money's gone with it. So unfortunately, even though we go into a very holy, sacred place, we're not free from people who abuse the crowds and try and steal what you've got. Other countries do have very systematic ways of performing tawaf, and as you can see here, there's a group of sisters surrounded by brothers, and they will walk around doing tawaf as a group, and this is a solid group. If you see a group like this, and they won't be in green, you can see next to it there's another group with pink scarves on, but if you see a group similar to this, get out of the way, because this group is not going to stop just because there's one individual in front of them. And believe it or not, even though the men are quite short men, the women are quite short, as a group, they're a formidable force, and they will work their way through. You'll sustain an injury, that'll compromise your Hajj. So do the right thing. Just move to one side, let the group pass, and then kind of rejoin the rest of the crowd in terms of completing your tawaf and sa'i. Risk of exhaustion is high, especially in this weather, so drink regularly. And as mentioned already, consider times when there's less crowding, avoid the midday sun. And now with multiple floors, although there is an assumption that if we're on the Madaf, it'll be shorter because it's a smaller circle around Kaaba, you've got to remember that the public is a lot more, so you're going to be moving a lot slower. So ask yourself, is it quieter on the first, second floor where you are under a roof, you have got air conditioning, and yes, the circle is bigger, but you can take your time, and it may work out that the completion time for your tawaf is still the same, whether you're on the top floor or bottom floor, but at least you've been under shade throughout. This is a picture outside Jamarat, but there are plenty of taps that you'll see that the Saudi authorities have put into place. You're very safe to drink the water from these. It is clean water. So every time you go past these areas, take a drink, because the weather is going to be very, very hot. Try avoiding carrying 2-3 litre bottles, because that is a heavy weight. Carry smaller bottles and fill them up regularly. As I say, if you're in the Europa camp, you're about 3 kilometers away from Jamarat, but throughout the journey, there are these water taps, and the Saudi army and authorities over the last couple of years, realizing the heat, have been very good, and they'll spray water on you, and they'll have fans, and they are very supportive towards the Hujjaj retaining good health. So common sense, use small bottles, fill up regularly where you've got the opportunity to have drink water. But again, if you're going with the group, just make sure you don't get left behind, because unless you're familiar with the streets in Mina, it's very easy to get lost. Avoid coffee, tea, fizzy drinks if possible, and as I've mentioned, carry a small bottle rather than a large one. Zamzam is excellent for quenching your thirst. It has nutrition as well as rehydrating properties. It's easily accessible, it's free. Try and avoid the cold Zamzam and opt for the room temperature Zamzam, and avoid gulping the water. And remember, contrary to what a lot of people may believe, gain the benefit of Zamzam, but don't stop taking your medication, because I've seen people go to Saudi Arabia who are diabetic, who are on long-term medication, and their mindset is, I'm in Saudi Arabia, I'm in Makkah, it's a holy city, I've got Zamzam, my illness will be resolved with the holy water, and they stop taking the diabetes treatment, and then they wonder why they had a hyper attack and end up collapsing. So carry on taking your medication as well. You can do both. In terms of Mina, in the tents, you will see these kind of buckets in the corner. They're filled with water regularly. They have ice blocks in there. If you're lucky, you'll have fizzy drinks in there, small cans. But yeah, keep yourself well hydrated. Try and avoid sleeping or sitting directly in the line of the air conditioning units, because you will get cold after a while. If these units are empty, then have a word with your tour operator. They'll speak to the local authorities and they'll come and replenish the containers. But keep a bottle by your side and just sip through the day. Avoid climbing mountains because you're there for Hajj, and especially for those that are going early who want to perform Umrah as well. They go on Ziyarah, they start climbing mountains, and the next thing you know, they've twisted an ankle and they're now struggling through the days of Hajj. What you do after Hajj is up to you. Do it with a tour operator in a guided tour, but especially before Hajj, try and retain your physical health and use a common sense approach. If you're going on Ziyarah, then stay in the car, go outside, but don't climb the mountains. Keep yourself well covered and keep a bottle of water at hand. The actual medical clinic, alhamdulillah, we've been blessed. Excuse this. The system's just telling me I need to close down my EMIS system. Let me just close that down so you can see the screen. There we are. There we go. So as I say, I've been going for over a decade, and over that period, we've always had the same tents in Mina, compliments of the Saudi authorities. And if you are unlucky enough to require medical help, then ask your tour operator where the British Hajj Delegation clinic is. We run the clinics from after Fajr time, roughly about 6 o'clock in the morning, and run it till 9 in the evening, 7 days a week. And as I say, the consultations are free. Whatever medication we've got is free. The only times we're shut is on the day of Arafah, and everybody's welcome. When you get to the Jamarat itself, avoid crowded areas. I've tended to find that when you get to the Jamarat, don't be tempted to rush straight into where the walls are at the beginning. If you go to the back of the walls, the rear end, you'll find it's much quieter and you can go right up to the barriers to do the stoning. Once you've done the stoning, move away, but be aware there are still people who think that they can stone from a distance. So you may find that there are small missiles going over your head. So take a sensible approach and just be aware of where you and your family are. In terms of after the days of Hajj, there are approved barbers further down from Jamarat when you come out at the other end. But for those who are going to go to Makkah, there are government-approved barbers there as well. Be aware in the days when you go back to Mina after Hajj, there is a lot of people who are tempted to shave their heads in the alleyways in the tents, where the tents are. And unfortunately, they don't dispose of the blades in a safe way. They just chuck it on the floor. And I've seen children playing around the toilet areas and around the wuzukhana areas. And this is predominantly where people tend to do the shaving. So first, be aware of blades on the floor. Secondly, make sure that if you are going to do wuzu or going to the bathroom, you've got your slippers on. But thirdly, and most importantly, be aware of where your children are and that they're not playing with blades or anywhere near blades. During the Hajj period, the ministry will put up leaflets like this in various hotels and across the streets. These are kind of evidence-based from their perspective, and they're familiar with what the main issues are. So if you do have time, try and read interpret the pictures and understand what they're trying to say, because they are trying to minimize you getting ill during your pilgrimage. In terms of hygiene, there are alcohol-free products available. Just be aware of the scented ones for the days of Hajj. And if you do develop a upper respiratory infection or a cold, then use a tissue and clean your hands to avoid spreading your germs to someone else. In terms of common ailments, the kind of things we tend to see are blisters, ankle swelling, Hajj, cough, insect bites, sore throats, dehydration, diarrhea. Most of this we can treat. But blisters are very common, mainly because people haven't used the right footwear, or they've walked a lot more than they should have done from one destination to another. So you can see the kind of repercussions. And last year, when I was there, even a consultant that was doing his Hajj, who I know, unfortunately developed blisters to the point that he ended up in a wheelchair. So it happens to the best of us, but any precautions you can take to minimize the blisters will improve your experience of Hajj. In terms of long-term conditions, these are the kind of things that if you suffer with any one of these, you need to make sure that before you go, you've seen your GP or your practice nurse and your condition is well under control. Be aware of what to do if any of these conditions exacerbate, and make sure that for those of you who are elderly or frail, that your family members know what to do should you have an exacerbation. In terms of first aid, you'll come across pharmacies in Makkah and Medina. It's more difficult to come across pharmacies in Mina, but consider taking some of your own first aid products with you. As I mentioned briefly before, if you do go into a pharmacy, the pharmacist will try and diagnose your condition. They don't tend to do examinations and things. It's done over the counter, but will then sell you what they think is the most appropriate product for your presentation. As mentioned previously, our clinics are in Makkah and Mina. We have, actually, coincidentally, I have just sent my passports for me and the doctors off this afternoon. So inshallah, we'll get visas hopefully next week. And if we get our visas, then hopefully we will be flying out within the next fortnight to go and deliver our clinics in Makkah and Mina. Final thing from me, I have written a free publication on 101 top tips for a healthy pilgrimage. If you go to the website for the British Hajj Delegation, we are at the stage of putting this on. Now, we don't have hard copy versions, but they are there as a PDF, so you can print it off. Most of the tips are a couple of sentences, but it takes you from preparation before you go out to perform Hajj all the way back to what you should do when you get back into the country if you've had an exacerbation of your illness whilst out at Hajj. And as mentioned, it's free, so hopefully you can use it as a resource. And that's my presentation finished. Jazakallah.
Jazakallahu khair, Dr. Mohammad Jiva. A really insightful presentation there, mashallah. I learned a lot. Alhamdulillah, Allah has given me the ability to go there, and mashallah, they were very relevant, very succinct, very pertinent points, mashallah, you raised there. We've had a few questions come in, and anyone else who wants to raise questions, please fire away, because Dr. Jiva has to run off to Birmingham in the next few minutes. So unfortunately, he won't be available for the last 30 minutes of Q&A. So if you've got any specific Hajj questions for Dr. Jiva, then please fire away. So we've been having some questions come through. So let's start with the first one. What is the best way of carrying money? Brother Atif is asking. Atif Mahmood.
The best way, firstly, carry the minimum amount of money you need. Now, there are belts, money belts that you can buy in this country that are designed for Hujjaj, that wrap around your bottom part of your ihram and also hold your ihram up as well. But my advice is that whenever you go for tawaf or say, firstly, don't take your money, all the money to Mina, because either you're going to carry it or you're going to have to leave it in the tent, and that is definitely unsafe because the tents are not locked. And when you're away from the tents, there's a risk that people who are not performing Hajj may end up going in there. Even though our tents are medical tents, we've come back at times and found people who are just sleeping there who are not Hujjaj, and kind of people just use any space they can. Don't take too much money when you're performing tawaf, and say, take enough money that you can go and shave your head afterwards, you can go and get one meal, but don't feel that just because you've taken hundreds or thousands of pounds, you want to take it all and carry it around. My advice is speak to your tour operator to see, is there a secure facility in the hotel? where you can store it. If not, essentially, we tend to leave it in a suitcase in the room, padlocked, with the room locked, so at least it's as secure as it can be. And unfortunately, unlike a lot of Western hotels where you go into your room and then they provide you a safe and you put your own combination numbers in, most of the hotels, unless you're going 5-star, most of the hotels during Hajj won't have that kind of facility. So the summary is, carry the minimum amount of money you need and make sure that the rest of your money is in a secure location.
Okay, Jazakallah khair. The question, can you please mention again the ideal row place to join for a safe approach for Jamarat? I think he's referring to your tip about stoning Jamarat from a safe place and a safe distance.
I'll explain it, and for those of the listeners who download the 101 tips, which, if I give you the email, it's britishhajdelegation.org.uk. Now, in there, there's actually a diagram I've put which shows you the path you should take. But if you think of the pillars as a rectangle or an oval, then as you go up to the beginning of the wall, walk around the wall to the far end, the back end, because you can stone anywhere around that pillar, and most people tend to go straight to the front end to do the stoning. So you find that the back end is practically empty, and you could even take a child or a toddler without anybody bumping into you. It's that quiet. Now, remember, the other thing to mention here is that although there are different floors in Jamarat, depending on which road you've taken from Mina to go to Jamarat, the authorities will funnel you into one of the specific levels in Jamarat. So you can't choose that I'll go on the first level or the third level. Depending on which direction you're coming from, you will be hustled into a specific floor. Do your stoning, go out the other end. Don't try and challenge the system.
Okay, don't try and challenge the system is the advice there. Jazakallah khair. Another question, what inpatient provisions for psychiatric exacerbations are there in the Kingdom of Saudi Arabia?
Well, hospital services during the period of Hajj are free as well. So there are, especially in Mina, there's a lot of Saudi clinics available. Now, most of these are manned by Saudi doctors or people employed by the Saudi authorities. They can speak English, but they may not be as familiar with English terms or English systems related to this country, because we've got to remember that these guys are dealing with Hujjaj from across the world, and people come from different healthcare systems. So in Mina, it's a lot easier. In Makkah and Medina, it's slightly more difficult, and you probably come across private clinics where you have to pay for care more easily than you'll come across the Saudi clinics. But access to hospitals is fairly easy. Even in Mina, there is a Mina hospital that you can go to. Mental health provision, I'm not as familiar with as physical problems, because a lot of the clinics and hospitals during the Hajj period are geared up to providing services for physical injuries. But I'm sure if you went to the hospitals, they'll be able to direct you to the right clinician within the hospital itself. Now, remember, the other thing to take, if you print off the 101 tips, in the back of it, I have put the number for the Foreign and Commonwealth Office. That's the British Foreign and Commonwealth Office that's based in Jeddah. So for those that are struggling with mental health issues, that feel that the local authorities are not recognise their need, the best thing to do is ring the British Foreign and Commonwealth Office and ask for support from the FCO officers that are present there.
Jazakallah khair. That's very useful, that particular number. So we'll take a couple of more questions. They are just coming in, mashallah, one after the other. Dr. Jiva has to leave, so I'll take two more questions, inshallah. So first aid, any particular courses tailored for common issues on Hajj? I didn't get that question very well. Any particular courses tailored for common issues on Hajj?
I wouldn't worry too much about courses because I've geared my advice in the book on the average person, not a medically qualified person, using first aid that you could get from any Boots, Sainsbury's pharmacy, anywhere across the country. The kind of advice in there is also related to the kind of footwear you should have. When you're not in the state of ihram, the kind of socks that you should wear to minimize the amount of sweating, to minimize development of blisters, the kind of powders you can use, the kind of blister packs you can use. So a lot of it is in there, but the things are like things for diarrhea, things for rehydration, the things Elastoplast, Compeed, all the kind of things that you could take. And even if you don't know what to do with it, the chances are there's probably a doctor or a nurse in your group somewhere who knows what to do with it. So if you can provide the materials, they're probably more than likely to provide the service in terms of applying the bandage or applying or giving you advice on how to take some of the over-the-counter medication you might have taken with you.
Okay, so just two more questions for you, Dr. Jiva, and then inshallah we'll move on to the next presenter. So I'm traveling with a 6 and a 4-year-old. Any advice, please? And another question, can we take debit cards for money instead of cash?
Yes, you can take debit cards instead of cash, and there are cash points, especially in Makkah and Medina. I don't know what your exchange rates are and what your banks are going to charge you for doing that, but you can take money out and draw riyals from the cash points. From a personal experience perspective, I've tended to find that when I go shopping, I find that bartering in sterling is always a better approach than bartering in riyals. But right. I suppose I'll leave that to the individual Hujjaj to decide whether they want to carry the money or carry a card. If you're going to use the money, then I suppose a credit card's always better because your products are insured compared to using a debit card. Putting aside the monetary thing, for the 4 and 6-year-old, I suppose the first question to ask is why. But if it's a family issue and for the adults to do the Hajj, they have to take the children as well, then their risk of dehydration is a lot more than for the adults. So you have to gear the whole of Hajj to the needs of the youngsters because they're going to get weaker quicker. Their nutrition, their appetite's not going to be as big as an adult's. And for those that, you know, as I said, from Mina to Jamarat is from the Europa camp is 3 kilometers and 3 kilometers back. And for a 6 and 4-year-old walking 6 kilometers is not easy. Now, for the people, the number of people that you're going to come across, you can try and take a pram, but it's going to be very, very taxing to try and push a pram through that bigger crowd. And the roads are not perfectly tarmac, so there's a lot of ditches as well. So the pram may go up and down, up and down. So I suppose the other question is, the other possibility is that if you have got people in your camp and people are splitting, Hujjaj are splitting. So, for example, one group is going off first, and when they come back, the other group will go second. Then if you've got family members or close friends, you may decide to leave the 4 and 6-year-old with friends in the tents rather than carry them with you.
Okay, and just one very last question, Dr. Jiva, if that's okay, because we've had 3 similar questions on this topic. I think you've addressed it partially before. It's related to codeine, basically. So I've been prescribed codeine by my doctor here for severe headaches. It is illegal in Saudi Arabia because it's opioid. What should I do to take it with me or not? I think you've answered it already, but 3 people have raised the same question.
Yeah, codeine's illegal, although it's available in smaller doses over the counter, and that's only something we found out in the last few years. But definitely, if you're going to take anything like tramadol, pethidine, morphine, it's a no-no, and it has to be done on a prescription from a Saudi hospital. For those that have got chronic conditions where you need that strength of pain relief or even the higher doses of codeine, my advice would be first get a letter from your GP to show that you need that strength of medication. Secondly, make sure your tour operator is aware that you're going to be carrying that kind of medication and that you've got a letter as well, and give him a copy of the letter in case the authorities stop you. And thirdly, if there's any ambiguity on whether we can or we can't, it might be worth dropping a line to the British Foreign and Commonwealth Office and getting them to ask the Saudi authorities so you've got it approved in advance. But that's mainly for people who are on high dose pethidine and morphine, 30 milligrams of codeine, 2 tablets 4 times a day. Although we think it's middle of the road medication here, the Saudis may perceive that as addictive medication and therefore may raise eyebrows and concerns if you haven't got the appropriate paperwork to support it.
Okay, Jazakallahu khair, Dr. Mohammad Jiva. Very insightful presentation, mashallah, there. I'm sure our attendees would have benefited immensely from this webinar. This will be available, inshallah, later on our YouTube channel. And I'd like to just say, have safe journey to Birmingham, and Jazakallah, after your busy day in the surgery. I know how it's busy it is in surgeries these days. After a busy day in surgery, Dr. Jiva is doing this live presentation from his surgery. So Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu wa rahmatullahi wa barakatuh. Okay.
Right, okay, so that was Dr. Mohammad Jiva from Manchester. Jazakallah khair once again for your brilliant presentation today. So next in line is Sister Ayesha Aslam. Let me just get my screen back on again. So just bear with me, please. Just having a bit of a technical glitch here. Right, okay. So next in line is Sister Ayesha Aslam. Sister Ayesha Aslam is a director and a founder of Sakoon Counselling Services. She's a clinical supervisor, BACP accredited integrative psychotherapist, psychologist, and an Islamic counselor. She has over 15 years of experience working with diverse issues from counseling to more severe psychological issues. She has been a keynote speaker at various conferences. Recent one includes training Muslim chaplains and imams in the UK. She has published articles in various magazines, provided workshops to organizations, and appeared on radio and television channels providing support and advice on key issues. And she's not afraid to be challenged on taboos. Sister Ayesha is a pioneer, a first in her field that set up Sakoon to address a need in the Muslim community, which was to have access to professional counselor service that would not compromise their faith. Today, Sakoon has 10 counselors, 3 trainers, and they deliver accredited courses and work with clients as far as Phoenix, Arizona, and Australia. So over to you, Sister Ayesha now. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum wa rahmatullahi wa barakatuh. Can you hear me?
We can hear you loud and clear. Sister Ayesha, now you're the presenter, and if you wish to, you can share your screen and your presentation with the audience.
Okay, just bear with me.
So just before you begin, Sister Ayesha, just to for the benefit of the listeners as well, I'm sure you will have plenty of questions. If you can keep on sending them, inshallah ta'ala, or we will whiz through them, inshallah ta'ala. If we can't address them straight away, we'll try and address them in the last 30 minutes of our presentation today, between 7:30 and 8 o'clock, inshallah ta'ala. So keep sending them through. So over to you, Sister Ayesha now.
Okay, Rabbi shrah li sadri wa yassir li amri wahlul uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. Just want to say Jazakallah khair to Dr. Mohammad Jiva. It was a really insightful talk, and I've definitely got some practical tips to take away. And also to the organisers at BIMA, may we all be able to benefit from today's webinar, inshallah. Thank you, Jazakallah khair, Brother Rashad, for the introduction. So today I'm here to talk to you about what are the most common mental health problems that take place during Hajj and how you can better prepare physically as well as psychologically. I'm not going to tell you about myself. I think the brother's given you a good insight about Sakoon. If you wanted to find out a little bit more, please do visit our website and you can get in touch with us, inshallah. So I wanted to just start off with what are the actual facts when it comes to mental health. So according to statistics, 1 in 4 people will experience a mental health concern. That is approximately 450 million people who globally suffer from mental health. So that's huge. And these statistics are just based around the sort of generic day-to-day sort of routines that we go through. And some of the most common mental health illnesses include anxiety, depression, bipolar, psychosis, OCD, obsessive compulsive disorder, and the list goes on. So what is mental health? So mental health is a state of one's emotional and social well-being. It describes the person's ability to carry on in their everyday life. It affects how we think, how one feels and acts. It determines how we handle stress, how we relate to others and make choices. A person's mental health is subject to change, so it does vary, and it's important at every stage of one's development, whether you're a child, to adolescence, to adulthood. Mental health problems can range from short-term issues such as anxiety and stress through to very extreme clinical problems such as psychosis. Most individuals will experience some mental health issue at some point in their life. So for example, sometimes we can get anxious or nervous when we're about to do a presentation, when we're about to have a change in our job, or we're moving home, or we're moving to a different country. We can also experience depression when we're going through grief, when someone has passed away, someone who's very close to us. So these sorts of emotions are very normal. And when it comes to mental health, it is on a spectrum where some of these concerns can be quite normal, like I've mentioned just now. It can be a sort of mild form of a concern, it could be moderate, and it can be severe. The causes of mental health can be down to a diverse range of circumstances which lead to symptoms and behaviors that are distressing to themselves or others. These symptoms and behaviors may require treatment or rehabilitation, which can include hospitalization. There are a significant range of mental illnesses, and they vary with degrees of severity, like I've mentioned earlier. So we can all experience emotions, such as being excited or happy. And these are examples of positive mental health. And this is something we don't necessarily talk too much about. At other times, we can also come across things where we struggle with. So this is when we may experience anxiety, worry, or stress. And these emotions are all part of our mental health. And when it comes to Hajj, initially, when we find out that we're able to go to Hajj, we tend to feel really excited, really elated, happy. Alhamdulillah, we're going to be able to complete our 5th pillar of Islam. And we feel that really positive sort of feeling. But sometimes what ends up happening is that when it gets closer to the time, we can feel a little bit worried. Oh gosh, what if something happens? What if I don't, what if I'm not able to perform my Hajj? What if I become unwell? And some of these worried thoughts and these emotions that we experience, it can be very, very normal. But if it does begin to affect our daily lives, where you start to notice that you're not able to function in your day-to-day routine, then this is when it starts to become a concern. There's many possible causes for poor mental health conditions, and these can range from difficulties in childhood, significant events such as relationship breakdowns, a bereavement, a sudden shock or trauma. It can be comorbid issues, so for example, anxiety can spiral out of control and it can lead into depression. It can also be related to genetics, so certain mental health problems, it can be passed down from families. So if there's a likelihood of chance of depression being in the family, it could possibly happen to yourself. You're a little bit more vulnerable. But the good news is that majority of people who do experience mental health problems, they can get over them, or they do learn to live with them, especially if they do seek help early on. So let's just look at Hajj. So Hajj is one of the largest religious mass gatherings in the world. It's estimated that approximately 4 million pilgrims perform Hajj, where 25,000 are British. Saudi Ministry of Health have set up approximately 21 hospitals during Hajj, and they also fund GPs from abroad, including the UK, to attend and support pilgrims. So it was really nice to gain some insight from Dr. Mohammad Jiva and the work, mashallah, that he does. And mashallah, they all do an amazing job supporting all the pilgrims, and may they be rewarded immensely for their efforts. However, further support is required, especially when it comes to mental health. Pilgrims themselves are being tested physically, physiologically, and psychologically. And you're probably wondering how, why? Well, it's exhausting. Firstly, you're in a foreign country, you're reliant on others where language and culture can be alien to yourself. Then you have the dry desert, the hot weather, the overcrowding, sleep deprivation, sleeping in tents and in the open, fear of getting lost, fear of your pilgrimage not being accepted, and having thoughts of what will happen to me. So this is what's going on for you emotionally. And these are the sort of thoughts and images that can come in your mind. And it's also a spiritually demanding environment. So this combination of physical, physiological, and psychological factors is very unique, and it makes it very stressful. If you do have a mental health concern, know that there are organizations such as Sakoon Counselling Services that can help and support you. And you are advised to speak to a counsellor prior to going on Hajj, so that you are able to manage your concerns and concentrate better on your ibadah. So let me just give you an example. I had a British female who was diagnosed with depression and health anxiety. She believed that by going on Hajj, she will be cured. However, as she was on Hajj, she got even more anxious and she suffered a panic attack. She did the right thing by informing her tour guide. Unfortunately, the tour guide brushed it off and didn't acknowledge the concern. And this only made it worse for this pilgrim. And I'm astounded that in this modern age, we have tour guides who don't acknowledge mental health conditions. You're probably wondering, how has this impacted on this sister? Today, she's scared to go on airplanes. She feels as though she's not going to be protected in another country. This sister, she reached out to us, and we're now helping her to gain that confidence, inshallah. Tour guides do need to be aware of mental health concerns. They need to know what to do and to not ignore them. They have a very special role to fulfill during Hajj. At Sakoon, we can provide training so you can be prepared to help the Muslim community where pilgrims feel supported and have a positive experience of Hajj. So let's look at what are the most common mental health conditions during Hajj. So according to research on Indian pilgrims in 2016, the most common mental health illnesses during pilgrimage was related to stress, insomnia and sleep disturbances, psychosis, mood disorders, in particular different forms of anxiety and depression. And the most common symptoms included sleep disturbances, fear of being lost, apprehensive, anxiety, where one would experience palpitations, panic attacks, they would become fearful, they would have fear of failing Hajj, and then they have this sort of process of wanting to give up. They've lost that motivation. The treatment that was received was psychotropic drugs, and this is where it alters the brain's function by changing the chemicals in the brain, so it can target certain symptoms affecting one's perception, mind, emotion, and behavior. Research also found that counseling and social support helped, and it was sufficient to address these issues. Research also found that some pilgrims who suffered mental health whilst on Hajj never had a mental health condition before. So this just illustrates that when going for Hajj, many people experience a complete shock to their system, and this can lead to an adjustment disorder, where they endure severe stress, where significant changes take place in one's thinking, emotions, and behavior. What we do on Hajj is not what we do on a daily basis. It is a struggle. It is something that we do once in a lifetime. It's a physical, it's a psychological struggle. Adjustment disorders, they tend to take place during transitions in our life or when there's an upheaval in life. People who do find change quite difficult can be quite vulnerable. Hajj is hard work, and it will have a toll on you physically and mentally, whereby it's important to try to prepare and know what to do in these cases to protect yourself. One thing you can think about is just to reflect on yourself and recognize what you're like when you're in that sort of state, when you're really tired, you haven't slept, you haven't eaten. What happens to you, and what do you do to help you cope? And this can be a way of helping you to control the situation that you might get yourself into. I also just wanted to touch on some of the common physical health issues that tends to take place. So one example includes hypoglycemia. This is where you experience low blood sugar levels, where one ends up feeling confused, apprehensive, weak, shaky. They have difficulty talking. It can also lead into seizures, so it can be quite fatal. Heat stroke, where one can become dehydrated and they experience fatigue. Gastrointestinal and respiratory illnesses is very common due to the close proximity, which can lead to infections being passed on, and you end up having a very low immune system. So as you can see, physical health can lead into mental health issues, and it can also be vice versa. So today, what I wanted to do was cover the two most common mental health issues that could arise during Hajj. I have kept it brief just due to the limited time, but I hope you're able to take a few tools away. We do have a self-help guide on our website that can provide you further information. So I'm going to just start off with depression. So when someone goes through depression, they tend to focus on the past. They dwell on negative thoughts. They're very pessimistic in life. They don't feel motivated. They have that loss of interest. Things that they used to enjoy, they don't enjoy it. Things they wanted to do, certain activities, they don't have that passion anymore. And they end up feeling very hopeless. And a lot of the times they end up having low self-esteem. So if you experience depression, it is important to seek medical support and speak to a counselor. But in general, the key is to do the opposite. So if you don't want to go out, it's important to go out. It's important to be active, even if you don't want to, as this is what maintains the depression. Socializing, interacting with others, talking is really important. The depression state tends to want you to isolate yourself. They don't want you to talk. They don't want you to do activities. They don't want you to have any joy in them. But it's important that you do. And it's important that even if you don't have that interest, just try. The negative thoughts, it's important to change them into rational thoughts. And what ends up happening when we are going through depression is that we're in a state of we're in an emotional state. So we're going to be thinking in the sort of worst case scenarios, thinking very negative, which is not rational. So it's also important that we try to change the way we think into a more rational way, which will enable us and help us out of the depressional state. If we look at anxiety, this is where one person tends to focus on the present or the future. They tend to worry a lot, ruminate. They are very tense and alert. They're always on survival mode, and they're not able to relax. Again, with anxiety, it's really about doing the opposite. So when you're tense, it's about being relaxed. So this is where you can do breathing exercises. One good mindfulness exercise that you can just take away with you right now is just breathing in. So taking a big deep breath and a big deep breath in through your nose, holding it for a few seconds, and then letting it out from your mouth. And just doing that for a few minutes can be really beneficial, but also notice the sensation of the cold air going in through your nose and the hot air coming out from your mouth. And what this will do is it will help to slow down the physical sensations in your body. So for some people, they may experience heart racing, sweating, fast breathing, and it also can help you to not focus on these negative thoughts that you're having, these anxious thoughts, because you're focusing on the present and you're focusing on just the breathing exercises. but it is important to be able to replace the anxious thoughts with positive thoughts. And it's this concept of mind over mood. What you think will impact on how you feel. So just to give you an example, if I said to myself, oh my gosh, I'm going to be crushed in this place, how will I survive? And I change that into I have control in how to manage overcrowded situations, and as a group we support one another. That's just one example, but you can tailor it according to what feels right for you. And this will make a huge difference in reducing the anxiety. If one experiences a panic attack, this is where one sometimes feels that they can't breathe. Some believe they may die or that they're having a heart attack due to the intense physical symptoms that's experienced. And it's really important that what you do at that point in time is you breathe slowly and you rationalize. And remember, it's just anxiety, and these symptoms that you're experiencing is absolutely normal. And you've just got to relax and breathe. Don't fight the feelings, just let it go naturally. And one key concept is if you have access to a paper bag or just clasping your hands together and breathing in that closed air will make it a lot more easier for your breathing just to go back into a steady state. So it can be a really uncomfortable feeling, but it will pass. And research has shown that there is no indication that it physically affects you or it leads into a heart condition, for example. If you see someone, just normalizing to them that it's anxiety, it will help them. So you may see people, and this is what you could do as a source of support. I remember my mum's first experience of Hajj, and this was, and she went with her parents when I was quite little, and I was at home with my dad and my brothers. And I remember she mentioned to me that she was extremely anxious on the first night. She started to scream. She had nightmares. She thought she lost me, and she kept shouting my name. And due to the shock of seeing so many pilgrims at one place, she became overwhelmed and she experienced anxiety. And it took her time to adjust to the transition in her life. Sometimes we can also experience symptoms of hearing voices, that we feel we might be hallucinating, or we think our dreams, our thoughts, our images are real when one hasn't slept properly. So our basic needs not being met will have a toll on us psychologically. And if we look at a theory on hierarchy of needs, it describes a way to motivate us to fulfill our full potential. So as you can see at the lower part of the triangle, it's to do with our basic needs. So if we are able to fulfill our basic needs, such as being able to be hydrated, having food, being able to rest, having a place where we feel safe and secure, it can then help us to move on to meeting our psychological needs. And this is where we feel that sense of belonging and love, where we can have relationships with friends, with our intimate partners. We can also then be able to achieve our goals, and that can then enable us to reach our full potential. And for us as Muslims, it's the idea of transcendence. And that in this situation, it's to do with being able to complete our Hajj, our final pillar of Islam, to be able to attain Jannah, and to be able to, most importantly, to be able to connect with our Rabb, Allah subhanahu wa ta'ala. And what you've got to remember is that this is our ultimate purpose in life. It is to worship Allah subhanahu wa ta'ala. And the way to do this is that we do have to look after ourselves. Islam is the middle path, and it is about balance. And this is the way to achieve it and to be successful, inshallah. So I just wanted to talk about some ways of how you can prepare yourself. So firstly, it's important not to be scared and to talk about your concerns. Just by talking about it will give you relief. I've actually had clients who have suffered internally. They've been abused, they've gone through marital issues, they've gone through depression and anxiety, and they've kept it to themselves for months, weeks, sometimes even years. And when they've had the initial session, they actually say to me that they felt a huge sigh of relief. They felt less burdened, and it made a huge difference for them. I've also come across people who feel guilty feeling this way, or that they're not being a good Muslim by having these feelings, or that they feel negative about Hajj and what the sort of experiences and the emotions that they're going through. There is no link at all. We're human, and it is a struggle, and these are signs for us to seek help. So like I've mentioned earlier, we do have self-help guides on common mental health concerns, so please do visit our website. You can also take a note of your own signs and symptoms and let your friends know, let your family know, let the group leader know. If you feel that you would need to have counselling, then do contact someone beforehand. Talk to your tour guide and let them know. They're there to support you. You can also, prior to going to Hajj, attend workshops. Mashallah, you've got Dr. Mohammad Jiva's 101 tips on his website, and this can help you to prepare on what to expect. You can also read books in terms of what are the stages of Hajj, preparing your du'as. And what this will do is it will help you to feel less anxious, it will increase your confidence, and you'll feel prepared, knowing what to do and what to expect. And the bonus is that you can help others too, inshallah. The key is support. So do go with a friend or go with a family member. It's a very, it's a once in a lifetime opportunity. It is difficult, so support is key. It's important to put a plan in place before traveling. So what I would suggest is exercising is really important. So just a brisk walk or a jog every day for 30 minutes can be really helpful. And then you can increase your pace as time goes by. And try to do this for at least a month. But if you can't, or a month has passed, just start now. It's never too late. And what this will do is it will increase your strength and stamina so that you can be able to manage the physical strain Hajj has upon you. And what exercise does is it increases your endorphins, this is your happy hormones, and releases the stress hormones. So you feel happier and you have a positive mental state. I don't know if anyone's ever been to the gym or done some rigorous exercise and afterwards you had this inflated rush of energy. And this is what I mean in terms of the sort of happy hormones. Diet is really important. You are what you eat. Research has actually shown that if you eat healthy, you feel less tired, you have energy, and you feel positive. With poor diet, such as junk food, eating burgers and chips, it does make one feel quite heavy, lethargic, and it can give one low mood, can lead into agitation as well as depression. We live in a society where we do focus on losing weight, being healthy, and keeping fit. And it is really important we utilize this, especially for Hajj, just like people who prepare for a marathon or they're going to do a rigorous sport. We're going to be physically and mentally tested. So it's important that we're able to manage it. Hajj is strenuous in one's mind and body, and it's important to try to fit in time to rest. So as well as the exercise, as well as the diet, you've got to relax as well. And for those who are parents, I don't know if you are a parent, sometimes when we're with our children, we're always on our autopilot. How do you think that will have an impact on us when we're with our children compared to the times when we have time out? So generally what tends to happen is we have less energy, we sometimes can get really frustrated. We can sometimes see it as a chore and not actually enjoy it. Compared to when we have rested, we feel a lot more relaxed, we have so much energy, we're positive, and we're eager to want to spend that time with our kids, and we can do a lot more. So therefore, you can be far more effective if you give yourself a break. We sometimes do have that notion of not wanting to miss a second of ibadat, but looking after yourself can be ibadat. And you can do this by making your niyyah, your intention of wanting to rest so you can perform more. And it's important that we have a realistic perspective and not an idealistic perspective. You've got to remember we're humans. It can also be related to waswas, so whispers of shaitan, where when we are vulnerable, it is a way of trying to distract us. Whilst on Hajj, don't be afraid to ask someone to help in completing your ritual if you're physically drained or you're scared to do so. Just to give you an example, when my husband was at Hajj, there was a man, an elderly man, and he asked him if he could hold him during the tawaf and hang on to him. And the reason for that is that he felt that if he did it by himself, he would become very anxious that he might fall, he might trip, and he might get crushed. So again, this is about support, being able to support someone. And if he didn't ask someone, he wouldn't have been able to have emotionally supported himself. If at any point you feel anxious or you're worried, do try to apply the breathing techniques. Think positively. Talk to someone. Remember, a problem shared is a problem halved. Just to give you another example, my husband, when he went to Hajj, he went with his friend. And they were he went with his friend, and his friend actually became traumatized after the first day of stoning at the Jamarat. He couldn't perform the second or the third day. And he asked my husband to complete this for him, which is completely acceptable. But you're probably wondering, well, how did he become traumatized? If you think about it, it's overcrowded. People are throwing stones. And as you get closer, it becomes chaotic and loud, and there's lots of emotions. And he looked around, his friend was there, and one moment, and then the next, he disappeared. And he noticed that the top part of his ihram had gone, and he felt extremely anxious, and he could hardly move. So these are just few examples that I've provided you, and due to the limited time, I do hope it can help for some of you. If you do see anyone experiencing mental health concerns, please, the minimum that you could do that would be so beneficial for them is just to go up to them, listen to them. Just your acknowledgement will help them greatly. Please remember us in your du'as. May you have a safe, blessed, and positive Hajj. Remember, we are here if you need any help. And please do like and support our work by liking our social media. Subhanaka Allahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilaik.
Jazakallahu khair, Sister Ayesha. Really love that presentation. Your advice of having a realistic perspective rather than having an idealistic perspective. I think it hits home really, mashallah. The message loud and clear there. And of course, to look out for other people who you might know be suffering with such similar disorders, conditions, shall we say. I mean, I can relate to it as well. I've come across a number of Hujjaj, who are, who become anxious, and especially in a crowded place. I remember vaguely a close friend of mine who went into a panic attack in Mina, as you rightly mentioned, especially just before Jamarat, and although Jamarat is now, mashallah, very well developed, and nothing compared to what it used to be about 15-20 years ago. But still, he went into a panic mode, couldn't move at all. We had to get him a wheelchair and, send him back to the tent. So very pertinent pieces of advice there, mashallah. So we've had loads of questions come in. So what we'll do is, inshallah ta'ala, we'll move on to our next presenter. Jazakallah khair, Sister Ayesha. We'll come back to you at the very end of of our webinar. Now we'll move on to our next presenter. So just bear with me. Okay, so our last presenter for today is Shaykh Dr. Asim Yusuf. Mashallah, very well-renowned scholar and a clinician. He goes by the pen name of Talib al-Habib. He's a consultant psychiatrist with special interest in Islamic spirituality and mental health. He is acknowledged as an authority on Islamic psychology and is regularly invited to deliver lectures and seminars on this subject. He serves on the advisory panel of Center for Islam and Medicine, as well as in an advisory capacity to a number of community initiatives and charities. He's the founder and director of Path to Salvation Diploma in Classical Islamic Studies, the Sacred Text Syllabus, and of the Islamic Ethics and Global Citizenship Initiative. He's authored 4 books on diverse aspects of Islam with a focus on classical spirituality. He's received 20 years of rigorous theological training at the hands of leading scholars of Islamic law and spirituality. So we have, and we are really honored to have on our webinar Sheikh Dr. Asim Yusuf. So over to you, Sheikh Asim. Can you hear us?
Assalamu alaikum wa rahmatullahi wa barakatuhu. Yes, I can hear you.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Jazakallahu khair, Sheikh Asim Yusuf, for joining us today. So the stage is for you now. So if you want to share your screen, inshallah ta'ala, you can do so now.
That's fine. Let me just right. Okie dokes. Let me just pull up my a presentation. I assume everyone can still hear me.
Yes, we can hear you loud and clear.
That's fine. Assalamu alaikum wa rahmatullahi wa barakatuhu. Alhamdulillah. والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. ربي يسر عيني يا كريم وافتح لنا بالحق أنت الفتاح العليم. ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. وصلى الله على سيدنا ومولانا محمد كما تحب وترضى بأن تصلي عليه. So, assalamu alaikum to everyone. Just while I am pulling up this presentation that I have prepared, we'll have a quick discussion about what I've been asked to talk about. So, as our Dr. Arshad mentioned, I have, as you might say, a dual speciality. In the sense that I have some expertise in Islamic law as well as in mental health. So what I've been asked to talk about is both of those two things. So a bit of information about the fiqh of Hajj, which I believe there was originally another speaker going to do, but they weren't able to make it. So a little bit of information about the fiqh of Hajj, and thereafter a discussion about some of the mental health issues, or some advice about mental health issues. Although I have to say that Sister, the sister, I'm sorry, is it Ayesha? Is that right?
Sister Ayesha, Ayesha Aslam.
Yeah, Sister Ayesha I think it gave an extremely good account of the issues relating to mental health. And I won't have an enormous amount to add to it, I don't think. I can't find the cut-down presentation that I had prepared. So what I'm going to do is I'm going to go to my own lessons, what I actually teach, and I'll just use the slides from there, inshallah. Right. So you'll excuse me if there's a bit of sort of flipping around between, if there's a bit of flipping around. Okay. Let's see if this is going to work now. Okay, you all still with me?
Yes, we can hear you loud and clear, and we can see your screen now as well.
That's great, except for the fact that the actual slides are not appearing properly, unfortunately. So let me right. Okay, so I'm going to try to. It would be useful for you to see them. So let me try and find them again. I don't stop sharing my screen, so I'm going to do that by. I think I'll just put the video for a second. There we go, and then I will try to share the screen at the same time. Okay, I don't know, Arshad, whether it's possible. It's not really possible for me to go back here.
What is it that you're struggling with, Dr. Yusuf?
What I'm trying to do is take this screen share off, basically.
Okay, fair enough. Don't worry about that. I'll do it for you.
Okay, if you can do that, that'd be great. And then I will. That's great. Great. If you can make me the presenter again.
Sorted? Yeah, you're the presenter now, Dr. Yusuf.
All right. Fine. Let's see if I can get it up this time.
Okay, right. While
Here we are.
Shaykh Yusuf is just trying to get the presentation running, got some questions which we had come through for Sister Ayesha. So what we can do, with your permission, Shaykh, is we can probably take a couple of those questions, if that's okay.
You can if you want, but the presentation is up.
Oh, it's up now. Oh, perfect, perfect. That's fine. No, absolutely. Go ahead. Yep, we can see it absolutely
Okay.
clearly. Jazakallah khair.
Lovely. That's it. Okay. Apologies for that. Bismillah wa salatu wassalamu ala rasulillah wa ala alihi wa sahbihi wa man wala. So in terms of Hajj, obviously there is quite a lot of detailed fiqh of Hajj. We're not going to go through that now. I want to whiz through this hopefully in about 10 or 15 minutes, just so that you can familiarize yourself with Hajj itself. I'm gonna assume here that everyone who's attending this presentation is going for Hajj, and that there's going to be quite a few doctors among them, which will be helpful when, a little bit later on. But let's take a look. This is the absolute basics now. So Hajj is 5 days. You may be going for 2 weeks or 3 weeks, but the actual days of Hajj are 5. The 8th, 9th, 10th, 11th, and 12th of Dhul Hijjah. And you can add 13th to that as well. And the way that Hajj works is quite neatly broken down into days. So if you can see this little diagram here, if you look at number 1, Mecca, so on day 8, on the 8th of Dhul Hijjah, which is the first day of Hajj, it's called Yom Tarwiyah. You will leave Mecca en masse and go and camp in Medina, in Mina, I should say. You spend the rest of that day in Mina. On the second day of Hajj, which is the day of Arafah, the 9th of Dhul Hijjah, you will travel from Mina to Arafat, the valley of Arafat, where you will remain until after sunset. Then, and that is number 3, where it says Mount Arafat. Then from there you will, after Maghrib, after the sun has set, you will leave Arafat and you will travel to Muzdalifah, where you will read Maghrib and Isha together and spend the night. On the next day, which is the 10th of Dhul Hijjah and the 3rd day of Hajj, you will go from Muzdalifah to past the Jamarat, so past the great complex where the stoning occurs, back to Mina, onto your tents and your camp in Mina. From there, you may choose to go to Mecca, perform the major tawaf of Hajj, and then exit Ihram before returning back to Mina. And you will spend the 11th, 12th, and possibly the 13th of Dhul Hijjah, which is the 4th, 5th, and 6th, if you added days of Hajj, stoning the Jamarat and remaining in Mina. So that basically is Hajj to go through that in a little bit more detail. Okay, so it doesn't show the diagrams, but on day 1, the 8th of Dhul Hijjah, what happens is you enter your Ihram. If you've exited Ihram, which you probably will have, you re-enter Ihram in your hotel room or Mecca itself, and you leave for Mina. You do that in the morning, and you spend the afternoon, evening, and night there in Mina. So after that, day 2, day of Arafat, the 9th of Dhul Hijjah, is the main day, really. Then day 2 and day 3 are really the main days of Hajj, where you fulfill the 2 integrals of Hajj. I'll explain what that means in a little while. And so day 2, what will happen is you read your Fajr in Mina, and then in the morning you will leave for Arafat. You will arrive at Arafat probably in the afternoon, and you spend the whole of the rest of the day at Arafat, where you will supplicate worship in various different ways. I'll talk about that in a little bit, inshallah. After Maghrib, after the sun has set on that day, you en masse, all the pilgrims leave for Muzdalifah. And Muzdalifah is kind of halfway, or a little bit more than halfway, between Arafat and Mina. It'll probably take you 3, possibly 4 hours to get to Muzdalifah from Arafat, although it's only possibly 3 or 4 kilometers away. You read your Maghrib and Isha together at Isha time in Muzdalifah, spend the night there, and you, at some point during that process, you'll collect your pebbles for the stoning. Just before sunrise of the next day, which is the 3rd day, the day of Eid, you leave Mina and you leave Muzdalifah and you head back to Mina. And on the way, and you can't really escape it because the roads have been designed in that way, on the way you will go into the Jamarat complex. And there you will conduct the first stoning that you do. Now, if you are a Hanafi, you stone only the first, what's called you stone only the first of the pillars before going back to your tents. When you're at the tents, what will happen? What would normally happen classically is this is when you'd sacrifice your animal. Of course, you won't be doing that. Somebody will be doing it for you, and your tour operator will tell you when your animals have been sacrificed. At this point, you can shave, cut your hair, and you can partially exit ihram, which basically means coming out of the unstitched clothing into your normal civilian attire, as it were. On day 3 also, you may perform the main tawaf, of what's called the tawaf al-Hajj. So the main tawaf of Hajj, you don't have to do it on this day, but most people choose to do it. But when we talk about health in a little while, we can talk about that perhaps in a little bit more detail. After you have performed the main tawaf of Hajj, you can completely exit ihram. And I'll explain what that means in a second. You return back to Mina, where really you'll be spending the rest of the days of Hajj. Days 4 and 5, you'll be in Mina. It is a sunnah to spend the night in Mina, although during the day you can go to Makkah, of course, if you wish to. But what you must do is each day that you are in Mina, you must go and stone the Jamarat, stone all 3 pillars. So you do that on day 4, which is the 11th of Dhul Hijjah, day 5, which is the 12th of Dhul Hijjah, and you may stay an optional day, which is the 6th day, 13th of Dhul Hijjah. If you do stay on the 13th of Dhul Hijjah, you stone the Jamarat there as well. The rest of the time is your own time. You can do really as you wish with that time. After you've left Mina, you go back to Mecca. You can perform you can do your tawafs, you can do your worship and what have you. Dare I say it, you can do your shopping too. When, however, it is time for you to leave Mecca, you must perform what is called the tawaf al-wada, the farewell tawaf. And this is the last tawaf that you do before you leave Mecca. And that, in the Hanafi madhab anyway, is wajib. That is a very quick overview of the days of Hajj. Now, and I do apologize because for some reason my very fancy diagrams are not appearing on your screen, which is rather annoying. Because unlike Sister Ayesha, whose slides were very exciting, mine, I'm afraid, are very boring. Now then, that all sounds very complicated, especially if you've not done it before. Don't worry about that. The way to perform Hajj is follow everyone else. Okay? Everyone is going to be doing the same thing that you're doing. There is no way that you are not going to get to that you're going to get lost on the way and somehow not get to Arafat. There is no way you are not going to perform the tawafs, because all you need to do is follow what the other 6 million people are doing. There are, however, 3 things that constitute the Hajj. So these 3 things need to be in place in order for your Hajj to be valid. Just 3 things. Those 3 things are the state of Ihram, that's number 1, the standing at Arafat, number 2, and the Tawaf of Hajj, number 3. If these 3 things are done, your Hajj is complete. Simple as that. As I say, there is no way on earth that you are not going to perform the second integral, which is standing at Arafat. Because everybody goes to Arafat. Even if you have taken sick, you are in hospital, they will arrange, the Saudi authorities will arrange an ambulance to drive you through Arafat at the right time. So unless you are literally in ICU, it is going to be extremely unlikely that you will miss this integral of Hajj. However, standing at Arafat between Dhuhr and Maghrib on the 9th of Dhul Hijjah, so at any point, for any duration between Dhuhr and Maghrib on the 9th of Dhul Hijjah, is the only time-specific integral of Hajj. It must be done during that time. As I say, it would take something special not to do that, so I wouldn't worry too much about that. Similarly, the Tawaf of Hajj needs to be done at any time after the standing at Arafat. So any time you can perform that Hajj, that Tawaf, I should say, in a situation, for example, where you have taken seriously ill and been hospitalized during your Hajj, the Saudi authorities will arrange, as I say, an ambulance to drive you through. You will see when you're at Arafat, if you're in the right place in Arafat, you will see ambulances just driving past. What they are doing is ensuring that pilgrims who have taken very, very ill or have become injured in some way are fulfilling the integral of Arafat. However, they're not going to take an ambulance and drive you around the Kaaba. So what do you do about the Tawaf of the Hajj? Well, that Tawaf can be performed at any point. At any point from your standing at Arafat till the end of your life. All right? There'll be things that you need to do. Your tour guide operators will explain it to you, but basically, you've got the rest of your life to perform that Tawaf. It is, unless there is a significant injury that you have or something, it is expected that that Tawaf is performed at some point during the days of Hajj. That is to say, before Maghrib on the 13th of Dhul Hijjah. Now, why is this important? There will be possibly pressure for you to perform the Tawaf of Hajj on the 10th of Dhul Hijjah. As soon as you have done your first, you come from Muzdalifah, you've done the first stoning in Mina, there will be pressure on you. People will say you have to do your Tawaf today. Now, if you can, if you are able-bodied, if you are reasonably fit, if you're in good health, then perform the Tawaf. But you are going to be performing Tawaf with 2 or 3 or 4 million other people. That is the most crowded day to perform the Hajj. So, if there are people who are unwell, older people, people who you feel are not going to be able to manage those big crowds, it is perfectly acceptable to wait for a day and perform the main Tawaf of Hajj on the 11th or even the 12th of Dhul Hijjah. When I performed Hajj with my wife, she became quite unwell when we were coming from Muzdalifah to Mina, and she told me, okay, we got back to our tent in Mina, and she said, okay, but I'm really not feeling well, but come on, we've got to go and do the Tawaf. And I said, no, you don't have to go and do the Tawaf. Oh, but everyone is saying I need to do the Tawaf. No, you don't have to. You can do it tomorrow. Rest today. And that's what we did, both of us together. We rested on the 10th. We did our Tawaf of Hajj on the 11th of Dhul Hijjah. Fiqh is about making things easy, not about making things difficult. And you will find that there is an expansiveness in the legal schools that allows ease, especially during the single most physically demanding act of worship that you will ever perform in your life, which is the Hajj. So I hope that's clear. So we've spoken about the second integral, which is standing at Arafat. We've spoken about the third integral, which is the Tawaf of Hajj. And I've said that you can't, it's very difficult to miss those two things. If you're going to make a mistake during your Hajj, the mistake that you will make will be in the matter of the Ihram. And this is why it is really important to understand what Ihram is. Ihram is not the clothing. I repeat, Ihram is not the clothing. Ihram is a state. The equivalent to Ihram is when you say the Takbir Tahrima to enter the prayer. Literally what it means is that certain things that were previously permissible for you are now not permissible during this state. So in terms of prayer, which is a simple analogy, it is permissible for me to talk to you, for me to not be facing the Qibla, for me to turn around, for me to stand up, sit down, and so forth. All of these things are allowed for me, but the minute I say Allahu Akbar, all of those things become prohibited for me. If you make salam to me after I have said Allahu Akbar, I can't answer you. If the food is ready, I have to finish and exit the state of prayer before I can go and eat that food. So, Ihram is like this. It is a state during which normally permissible things become prohibited. Or to put that another way, it is a state of pilgrim sanctity. Now, how does one enter the state of Ihram? It's very straightforward. How do you enter prayer? You enter the prayer by making an intention, fulfilling the preconditions, and saying Allahu Akbar. How do you enter the Ihram? You enter Ihram by fulfilling its preconditions, making the intention to perform Hajj, and making some dhikr. Ideally, that dhikr is the talbiyah. Labbaik Allahumma labbaik, labbaik la sharika laka labbaik, innal hamda wa ni'mata laka wal mulk, la sharika lak. It doesn't have Allah by saying Allahu Akbar.
Sorry, we apologize for the
have
technical error
intended
here.
and you have performed
Sheikh
the
Yusuf,
dhikr, you are now in a state of ihram. It is obligatory to enter the state of ihram. Or you reach that point as you are still in your
it looks like we're having some technical issues here. So I do apologize. It looks like Dr. Yusuf got disconnected there, probably due to a connection problem. So inshallah, what we'll do is we'll wait for him to connect, inshallah. And while we're waiting, what we'll do is we'll take some questions that have been coming through. So Sister Ayesha Aslam is with us at the moment. So Sister Ayesha, we've had some questions come through to us. So Sumaya Sadiq, she's asking, I think you've answered some of these questions before, but I think this is a kind of a personal question here. So I awaken several times at night because I've forgotten to do something or I've missed Fajr. I will jump out of my bed many times. I can't seem to switch off. I'm tired all day and suffer from anxiety, chest pain that can lead into panic attack. I was fine for 2 years and it got triggered again in Ramadan. Can you tell me how to deal with panic attacks and anxiety-related chest pains?
Okay. So it just feels like the anxiety has just worsened as time has gone by. And the thought processes is it could possibly be connected to waswas, which is the whispers of shaitan. So when we hear this concept of I've forgotten my salah, let me go and repeat it, even according to Sharia law, if it happens more than 3 times, then they do state that it is waswas, and that you're advised to not continue with listening to them thoughts, because as you might be aware, waswas does disguise themselves as our own voice. So this is where we've got to distinguish between the two. And when it comes to anxiety, when we dwell and we focus on these anxious thoughts, what we do is we make that voice stronger and louder, and then it takes control of us. And this is where the anxiety then deepens and worsens for ourselves. And then it leads into the physical symptoms where we're constantly tense, which then will have an impact on us physically, where our chest will start to hurt in this situation. The panic attacks. So you're in that sort of flight and fight mode. Okay, so your body's in that position of survival, but you're using it on a day-to-day basis constantly, as opposed to only in positions of survival. And hence where she's experiencing all these symptoms. When it comes to panic attacks, like I mentioned in the talk earlier, and with anxiety, it's really important that you slow your sort of physical symptoms down, that what's going on. So you've got to take a lot of breathing techniques. You've got to relax. You have to keep reminding yourself it's just anxiety. It's absolutely normal. Think about positive things. So like I mentioned, just doing a breathing exercise, thinking about the cold air going into your nose and breathing out from your mouth can be helpful. With the chest pain, what you can do is another exercise where you focus on each part of your body. You tighten that part of the body and then you release it. So it's almost like any tension in your head, you just kind of tighten it and tighten your eyes. Any pains there, you release it. When it comes to your chest, it's almost this sense of just focusing on that. Any tension, you just say to yourself, I'm going to release it. So there's a lot of mindfulness exercise that could be really helpful for you, sister. And when it comes to panic attacks, it's about reminding yourself of thinking positively and breathing really slowly. It does feel it's a bit more in depth, so I would suggest that you do talk to somebody as a counsellor, just to get to the root cause of the problem.
Jazakallah khair, Sister Ayesha Aslam. Now, good news. We've got Sheikh Asim Yusuf back online with us. Sheikh Yusuf, can you hear us?
Assalamu alaikum. Yes, I can hear you fine. Thank you.
Wa alaikum assalam wa rahmatullah. So, if I remember correctly, I think the last time we heard you, we were doing the takbirat, labbaik Allahumma labbaik, the talbiyah, and you were discussing the ihram, the conditions of ihram. So yeah, the floor is back for you now, so you can recommence.
That's fine. I'll Assalamu alaikum.
Wa alaikum assalam wa rahmatullah. Yes.
Okay. So I'll keep it fairly brief. We were talking about ihram, and I was saying that ihram is really the one thing that you need to ensure that you fulfill the requirements of. All right. So there will be a point at which you need to enter ihram. If you're flying into Jeddah, that point will be before you arrive in Jeddah. If you are coming from Medina, that point will be a place called Dhul Hulayfa, which is just outside Medina. So for those coming from Medina, the simplest thing is to enter your ihram from Medina itself, from the hotel in Medina itself. For those of you who are coming straight into Jeddah, I would advise that you get yourself ready, but you only need to enter ihram. And remember, entering ihram is intention plus dhikr, not putting on the clothes. The clothes need to be on before you enter the state of ihram, but entering ihram itself is intention and dhikr. That can be done on the plane. They will give you an announcement, say we are 5 minutes away from the miqat. Once that happens, you can just say, okay, I'm going to enter my ihram now. Labbaik Allahumma labbaik, labbaik la sharika laka, labbaik inna alhamda wa ni'mata laka wal mulk la sharika lak. Done. You're in ihram now. Okay. Now, ihram, as we said, is a state of grace. There are certain restrictions, and the restrictions very much relate to a couple of things. The first is clothing. Now, the clothing restrictions are only for men, not for women. Women can wear ordinary clothes. Where men are concerned, there is a restriction in terms of not wearing stitched clothing and wearing a particular type of footgear. Now, the stitched clothing, the unstitched clothing is the normal ihram gear that you buy. So if you buy the normal ihram gear that you get in a shop, that suffices you. You don't have to worry about anything else. Obviously, give yourself a practice run before you try it on, because you don't want an ihram accident in Mina or something like that. So one of the things you do to prepare for going for Hajj is try on your ihram and walk around with it and make sure it sits the way you want it to sit. In terms of footgear, in the different madhabs have different positions about what needs to be covered and uncovered. If you're a Hanafi, the only bone of your foot that needs to be uncovered is called your navicular bone, which is basically the sail bone. If you run your, I'm going to, excuse me, but I'll demonstrate. But if you take your foot like this and you run your hand up your foot, there's a bone that protrudes here from the top of your foot. That's your navicular bone. All right. That's the only bone that needs to be uncovered. Now, people often talk about sandals, the normal kind of two-strap sandals. No, those are problematic because the top strap covers that bone. The easiest thing to do is get a pair of old trainers, take the laces out, take the tongue of the shoe, take the tongue, flip it back on itself, and just wear the shoes, right? That way, that portion of your foot, the top part of your foot, will be uncovered. That's all that needs to be uncovered. Your foot gear is sorted. No socks, please, for men. And gents, no underwear. Be aware. So remember, this is the clothing for men for the state of ihram. So there are restrictions on the clothing, on the footgear. You need to be in ihram. That is to say, in those clothes, on the 8th, 9th, 10th of Dhul Hijjah. After the sacrifice is done and you've done your stoning in Mina, you can remove those clothes and put normal clothes back on. So you're talking about 3 days, basically. The other thing that is impermissible is things that have scent. So you need to be very careful about things that have scent, including things like scented creams, scented shampoos, those sorts of things. You need to be very, very careful about these things. And the best thing to do is buy unscented toiletries. Now, you may think that the shops in Mecca must be full of unscented toiletries, and you'd be wrong. They are not. Take it from the simple range, for example, or you get, I think there are, Muslim stores that will have them now. So there are various versions. Get some unscented toiletries, toothpaste, soap, creams, and whatever it happens to be. Okay. The other caution is about hair falling. So just be aware of that. I'm not going to go into detail about these things. I've got a book on the fiqh of Hajj that is 400 pages long. We don't need to go into the details. You're going with tour operators. If you have any questions, ask them. If you want to do something, ask them first, just to make sure that it's okay. So that's the fiqh of Hajj. I don't think I want to cover anything else because it gets a bit complicated. But your tour operators will be able to advise you on what to do. So I'm happy to leave it there and deal with the mental health side.
It appears we have got connection problems again. We'll give Shaykh Asim Yusuf 1 more minute, inshallah, to see if the connection. Yeah, I think he's back now. Can you hear us, Shaykh Yusuf?
Okay, let's do this. Can I please where? Hello?
We can hear you now, Shaykh Yusuf. Can you hear us? Wa alaikum assalam wa rahmatullah. Can you hear us?
I can hear you. Yes, I don't know where I cut off. The last thing I
Uh,
said was, that's all I want to talk about the fiqh of Hajj. I'm happy to move on to the mental health side of things.
Absolutely. We followed you up till there. Absolutely.
That's fine. So I know there are a number of questions, and I want to give enough time to ask them. All I will say is this, that Hajj is, as both the previous speakers have said, Hajj is a tremendously demanding few days. Hajj for the next 10 years is going to be in summer. It's going to be extremely hot, and there are going to be many, many people there. The advice that the Saudi authorities put out about making sure that if you are unwell, that perhaps you don't come for Hajj is good advice. Remember that in order for Hajj to be obligatory upon you, you have to have good enough health to be able to make it. If your health is not good enough for you to be able to withstand the rigors of the Hajj, and I have to say this and make this very clear, Hajj is not obligatory upon you. That's really important to understand. Okay? You have to be healthy enough in order for Allah to make the Hajj obligatory upon you. Now, that also applies, of course, to mental health as well. As I think Sister Ayesha mentioned, the crowding is something like you will never have experienced in your life before. It can be quite overwhelming. You can feel quite claustrophobic, and you can get exacerbations of mental health conditions. So, a couple of things, and I think she's covered anxiety and depression quite well. Company is really important. Have your little group. I mean, you may be going with 300 people for Hajj, but have your little group of, your buddy group of maybe 5 people, or if you're going with a family, then that group of people, and stick together, and make sure that you don't get separated from each other, because being alone in a crowd is the worst form of being alone. So be very careful about that. Some of the techniques about the breathing are extremely beneficial. Extremely beneficial. Just that long, slow, deep breathing is very powerful against rising anxiety. Okay? Use sensible things like, if you've got your phone with you, you've got a smartphone, you can set GPS locations. So where your tent in Mina, you can fix a pin there on Google Maps or on Apple Maps or what have you. And wherever you are, if you get lost, you can use your phone to guide you back there. All you need is the GPS. You don't need data or anything, just the GPS working. So there are simple things that you can do. However, one thing that needs to be focused on, and of course, my focus as a psychiatrist tends to be on the more debilitating forms of mental illness, the psychosis, the mania, and so forth. Insomnia is an extremely important aspect. Something that really can upset a person's mental equilibrium. Insomnia is a very well-known trigger for bipolar disorder as well as for psychosis. So these are things that one needs to be extremely careful about. If you are on medication, take the medication. Hajj does not and never has replaced medication. All right? Yes, you are in a state of ihram and you're in a state of grace, but you still need to eat, you still need to drink, and you still need to take your medication. So be careful about your mental health. Remember that the worship in Hajj is simply being there. All right? You do not have to exert yourself to do more worship. There are many forms of worship, but Arafat, for example, just being at Arafat is an act of worship. The tawaf, just performing the tawaf is an act of worship. All right? You don't have to necessarily stay up through the whole night doing dhikr and spend every single moment that you have in that sort of state. If you can do that, that's great. But my simple advice to people who've gone, and I've just waved a few people off, is if you've not been able to do it this far in your life, you're not going to be able to do it on Hajj either. So bear that in mind, and remember that the Prophet ﷺ said that this religion is vast. It will overwhelm you if you try to encompass all of it. When the Sahaba said, Ya Rasulullah, then what do we do? He said, Saddidu wa qaribu. Be moderate, take it easy, and draw near step by step. Do what is within your capacity to do, and keep an eye on your mental health. Now, I'll leave the floor open now for any questions, because I know that there are a few. Just a comment on, I think the question that I heard about, somebody was talking about, I think Sister Ayesha answered it, but somebody was talking about continuously going back and reperforming their prayers and so forth. I'm going to second the advice that Sister Ayesha gave. I think you probably need to see somebody about that, because it sounds like you may be developing an obsessive compulsive disorder. So go and get some advice about it, because there are specific forms of therapy that are very helpful, in addition to the general advice that Sister Ayesha gave about anxiety.
Jazakallahu khair, Sheikh Yusuf. Really important point there, that Hajj basically means being there, and if you can do extra ibadah, really good for you. If you can't, just being there is what Hajj is all about. So Jazakallahu khair. What we'll do is now take some questions. They've been building up. So we'll try and cover as much as we can, but I do appreciate that the time for this webinar was up till 8 o'clock. So we'll try and cover as many as we can, inshallah. So right. Are there any particular du'as? I think, Sheikh, you're probably best suited to answer this question. Are there any particular du'as that one can recite, or any actions if one starts to get angry or frustrated with people around them? As there are so many nationalities with language barriers and people have varied customs, it can get heated in certain situations, like near the Black Stone, Riyadul Jannah in Medina, especially for sisters, and at Jamarat. So yeah, so the question is basically, are there any particular du'as that one can recite to get over any angry or frustration situation?
Right. So first thing to understand, and I'm going to keep this now. You know, they say never give a sheikh a microphone, but I'll try to keep it as short as possible. The first thing to remember is that du'as are not a magic spell. Okay, the du'as are there to establish, for you to establish a relationship with Allah, to put things in the context of transcendence, or take ordinary things and put them in a context of transcendence. Okay, so if you are saying, is there a du'a that will act like lorazepam for me and calm me down? Possibly for you specifically, but not generally, no. If you are getting frustrated, the first thing, the most important thing here is prepare. You are going to get frustrated. One of the great mujahadas of Hajj, one of the great spiritual endeavors of Hajj is to deal with frustration. There is going to be frustration. If you are going there expecting this to be a transcendent spiritual experience for you, yes, that may happen. But it may also be that you are hungry, tired, being pushed about, and getting increasingly fed up. So prepare for the fact that it is going to be difficult. There are going to be lots of people, and quite a few of those people are going to get on your nerves. All right? If you are ready for it, then it's not unexpected, and you can deal with it better. In terms of specifically things to recite, so the Prophet ﷺ advised reciting, if you start to get angry, A'udhu billahi minash shaitanir rajim. Now what this means is I seek protection with Allah from the accursed devil. The really important thing to remember about the ta'awudh, saying A'udhu billahi minash shaitanir rajim, is which devil are you seeking protection from? Alright? This is the critical thing. You are seeking protection from the devil within you that is inciting you to become angry. So really, you are asking Allah to protect you from your own anger. Right? If you say A'udhu billahi minash shaitanir rajim with this understanding, it helps you to calm down much more, because it helps you to recognize that you're not getting angry because of that person pushing you or those people speaking in a foreign language. You are getting angry because of your reaction to those people. You cannot control what those people are doing, but you can control your reaction to it. All right? The other great advice of the Prophet ﷺ is smile. Smile. All right? You're their experience. There is no such thing as a 5-star Hajj. Not when you're making tawaf, there isn't. There are no special lanes for you, anything like that. You are there for the experience. It's all part of the experience. Everything that you're experiencing, in a year's time, you will laugh about it fondly when you remember it. Okay? Keep those things in mind, inshallah, and make whatever dua helps you to focus on Allah.
Okay, Jazakallah khair for that advice, Sheikh. Right now, we've got loads and loads of fiqh issues, and I'm sure we can spend all day, and those questions will.
Ask your tour operator, ask your tour guides.
Okay, right. Okay, ask your tour guides. Okay, perfect. Right. Okay. Sheikh, the question is, I'm so for the listeners, I'm deliberately skipping the detailed fiqh questions because this webinar was not designed for that particular purpose. So I've just asked some general questions. So there is a question: permissibility of travel and health insurance for Hajj. What's the Islamic ruling on that? We've had two such questions pop up before as well. What do you think, Sheikh, about what's your advice on that permissibility of travel and health insurance for Hajj?
So what's the permissibility of insurance? Is insurance permissible? Is ultimately the question here. I was under the impression, and I don't know much about Hajj in terms of the practicalities of it, but I was under the impression that the health that was given to the Hajjis was free. Is that right? I don't know whether Dr. Jiva mentioned anything about this.
You have to pay for your medication, so unless you are in a center,
hospital and that sort of stuff.
Absolutely. So you have to pay for your treatment there, except for the health centers, the very basic health centers, which are the mobile health units. Then it's not. But otherwise, if you're admitted, then you have to pay for it.
I see. My advice is that as a general principle, insurance is not permissible. However, especially if you have health conditions and you feel that you may have to pay prohibitive amounts for your health insurance, then as a matter of necessity, you can take it out.
Okay, Jazakallah khair. As I said, there are loads of questions, but more specific to your specialty, Sheikh. There's a question to yourself. What is your experience of mental health attitudes and service provision in the Kingdom of Saudi Arabia? Did you see any mental illnesses when you were at Hajj, and did you provide any support at the risk of detracting your own self from the rights of Hajj? So kind of giving help, like we've got loads of medics on this webinar. So what they perhaps alluding to is that should we be kind of getting involved in this kind of management, mental or physical illness management?
Okay. So I have been for Hajj once. I'm not an expert on Hajj in that sense. I've been for Hajj once. I saw minor mental health issues while I was there. I spent my time, yes, helping people with those things. In terms of attitudes towards mental health, I think that probably the Saudi authorities must have seen enough mental health conditions. So the government, the government and so forth will have, the hospitals there will have mental health departments and so forth. I'm sure they see plenty of this. In terms of your Hajj tour guides and operators and stuff, they are people from the local Muslim community. They will have the attitudes that Muslim people have, except that they may know a little bit more about it because they've dealt with these sorts of things before. It very much comes down to experience. It's something to ask your tour operators, actually, that what provision do they have for people who have mental health issues. In terms of how you should spend your time in Hajj, the best way, bar none, the best way that you can spend your time, the best form of worship that you can provide, that you can perform during Hajj is to be of service to other people. In whatever way you are of service to other people, but help other people out, right? You will get far more reward for helping somebody around a tawaf than for doing 3 more tawafs, all right? Or for helping somebody with a medical condition that they have within of your competence, of course. And this is certainly how I spent most of my time during Hajj was spent either answering fiqh questions that people had or dealing with people's health problems, and I feel it was an extremely enriching and something that I, you know, my spiritual experience during Hajj was actually in that. It was in helping other people, and I would advise you to do that.
Okay, Jazakallah khair. And just to please our other attendees today, we'll take one question on fiqh, if that's okay, Shaykh. So, a question regarding women. So, for women, ihram, do women have to have all their hair completely covered even when they are in privacy? So, in privacy, or when they are with their mahram, for example, going to bathroom or in the bedroom when they are at their hotel, can you please give any details for women's ihram?
Right. So women's ihram is civilian clothing, ladies. It's whatever you'd wear normally. Obviously, you'd probably wear something long and flowing, but it's the type of thing you'd wear normally. Obviously, hijab, they're not going to allow you inside. Even if you are not normally a hijab wearer, this is the time you're going to do it, of course. But the rulings of hijab are exactly the same during Hajj as they are any other time. So your head has to, your body has to be covered with the exception of your face and your hands and your feet in two situations and only two situations, whether in Hajj or outside of Hajj. That is, number one, when you are in prayer. Number two, when you're in the presence of a non-mahram man. Okay? At any other time, if you're in the hotel room with your husband, no, you can dress normally. When you're having a shower, you can have a shower normally. You don't need to worry about that at all. There are no specific clothing requirements for women during Hajj in Mecca or in a state of ihram.
Okay. Jazakallah khair. I think with that, we come to the conclusion of our webinar for today. I would like to thank our presenters once again, Sheikh Yusuf and Sister Ayesha Aslam, for taking their very precious time out and sharing with us these gems. MashaAllah, very, very informative. I really learned from this, and I'm sure our listeners and people who will listen to this webinar in future as well will benefit from this immensely. I'd like to just pray for all our brothers and sisters who are planning to go or are already on Hajj, that may Allah make their Hajj accepted, and may Allah make it easy for them, and may Allah safeguard them from any illnesses, whether it's medical, more physical or spiritual in nature, or more mental health related issues. So with that, we come to conclusion of our webinar today. Jazakallahu khair. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر سبحان الله وبحمده سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. السلام عليكم ورحمة الله وبركاته.